one thing I hear tossed around more and more, and I'm totally on board with personally, is we've kind of made this shift in dentistry from, periodontal disease being a infection or, to that it's more of a host immune response. So it is more about the chronic inflammation, and it's how the body responds to the presence of biofilm. And we've now shifted our focus from scraping calculus off teeth, and we're looking at it with a little better lens of we need to be disrupting biofilm. We need to be, creating an environment and talking to patients about, their diet and what other comorbidities they could have as a result of, that inflammatory state that's just gone from an acute to a chronic state.
I don't see acute periodontitis very much anymore. Too
Really?
many antibiotics in the system, but coming back to your point, when we start to look at significant chronic periodontal infections, a major comorbidity is occlusion. It is a major comorbidity and oftentimes is not effectively addressed.
Right. How does that present radiographically?
Well, you can look at widened PDLs and things of that nature, but you can't see mobility on a radiograph. There's a lot of clinical data that's got to be accumulated and processed. But again, in restorative dentistry, you fill a hole, fill a space. In periodontics, far too often people are just looking at inflamed gum tissue and trying to address the result of the problem, not really going back and trying to understand what are the comorbidities. Is the person diabetic? Is this person obese? Are they a smoker? What are these other kinds of factors that come into play? Yep. And if they're not adequately addressed, then you're only scratching the surface. And people are anticipating that your therapy is going to cure them. And I certainly make it clear to the patients that I treat that nothing I do is going to change your genetics. Right. And you need to be as active a participant in your care as we do.
Right. That's great. One more question for me. What about lasers in your practice, or the future of lasers in treatment of periodontal disease? I think, we're currently doing a laser protocol that we've seen some really good results. I'm curious from your perspective, what are your thoughts on the laser?
Very positive. I became involved with lasers in 2011, and that is my primary treatment modality now for periodontitis. I've been very, very carefully chronicling the treatment outcomes over years, and the results are very, very impressive. People don't hurt post-operatively. In one therapeutic session, you're basically eliminating the active infection in their mouth.
Yeah.
That's powerful.
Absolutely.
So you can take people that have these medical comorbidities and take this one off the table.
And patients get lasers, everything's laser surgery, LASIK, and so it's not something that's scary for them, it's something that they're quite familiar with and open to.
They're open to it, and when they begin to understand the benefits and the significant reduction in their post-operative course,
sure,
they're very interested in it, yes. And again, the results are really as long as you follow the protocols. But we talk in AS about taking the time to uncover causes of problems and following through in that way.
Get to the root.
That's really what it's all about.